Hi everyone, welcome back to ADC Aspirants. I'm Dr. Henna. Today's video is about explaining and trying to decode scenario-based questions, which all of you who are appearing for the ADC exams, you would know that scenario-based questions are the mainstay of the exam. Basically, all of us know sometimes the concept, but scenario-based questions are like puzzle pieces, which we've got to put together because it's not just one question we are dealing with, but we are dealing with the entire scenario as a whole. So I'm going to be discussing one scenario which has around 4 to 5 sub-questions, and this is the pattern of the examination usually. So let's begin, and with every question I will discuss about the possibilities of other answers not being the correct answers. Why do we choose one answer and why not the other? So let's dig into it, and probably we'll be able to understand better. So we've got a scenario here where we have a lady patient, a female patient, Serena. She's recently given birth and she has 2 children. She works full-time at a farm. She has a history of smoking around 10 cigarettes per day and she's struggling to stop smoking. The diet history shows regular coffee and tea drinks and also using fluoride toothpaste. She's brushing once daily and flosses when she remembers to. She's not concerned about the teeth appearance, but she's looking for a quick and affordable treatment, being busy at work, and also has certain financial constraints. Now, we have a picture which has been given to us. Let me tell you beforehand, this is a disclaimer that the pictures that you may see in the subsequent slides may not be the same. They may not correlate to the same patient as we see, but I've added various pictures just to streamline and to show you all what different kind of pictorial representations you can get in the exam. So the question here is, she wants to know what is the black stain on the tooth 4-3. So we're talking about the mandibular right side canine. Now, first of all, when you read such a question with so much of history and information given, what do? And I'm talking about the examination day. You've been given, a pen and a paper or whatever you can write down on. Use that to write all the keywords. How do I decide what are my keywords? Basically, whatever is given in the question, you've got to make sure you're able to extract the correct information. So she's somebody who's working full-time. I would write that smoking 10 cigarettes. So it could be a risk factor for everything, isn't it? There is diet history given. So we know that this particular question is about caries. So the moment you start spotting caries is the moment you start doing your risk factor association as well. Now, if you are somebody who's new to this ADC examination or even scenario-based questions, solving, you would probably think that this is too much. What is risk assessment and what is, keywords writing and all that? There's a lot to it, which you need to decode, but I'm going to be talking about particular scenarios. So coming back to this one, we have around a lot of information, already given. So regular coffee and tea drinks, what does that cause staining? As we know, she's using a fluoride paste, but she's also brushing once. So number 1, my keyword was full-time working. Number 2, smoking. Number 3, diet related. And number 4, oral hygiene. Now, when I say you note down the keywords, I don't mean that you start writing stories on the day of the exam or when you're practicing SBQs. You've got to write in abbreviations, brushing once or just B once. So these are your, tactics or strategies which you've got to maximize over a period of time. Time is of essence in both the part of your exams, whether it's a written examination or your practical examination. So make sure that you're up to date with your time management. So she's not concerned about the aesthetics. So that is the first thing that we are talking about when we are thinking of our treatment. She's not somebody who's overly concerned about her teeth looking absolutely glam white or anything. Another thing, financial constraints. If you are preparing for the ADC examinations, make sure that you've gone through the professional competencies which ADC has released, and they keep releasing every now and then. They keep revising it. Financial consent or financial aspect of any treatment planning is very, very important. It's not important what you think is the best for the patient. I'm talking about the exams only. Please don't take me otherwise. It's not just important what you think, but it's also important what patient can afford. So let's talk about this question. They're asking you, what is the stain? And you've got 4 options. And I know many of you would have guessed it right. The answer, yes, it is A, arrested caries. But when you're problem solving scenario based questions, always question yourself, why is it not B? Why is it not C? Why is it not D? In smoking, you would see stains all over. They would be generalized. And these are not stains that you see. These are basically carious lesions that you see, which are centered around particular areas, right? Active root caries. In a while, I will show you a picture or a flowchart or a distinguishing table between active and arrested caries to make you understand what is the difference, and incipient caries as well. So you must know how all of these carious lesions or how all of these stains look like in order for you to arrive at your correct answer. So I'm going to take a moment to take your and draw your attention to this slide that I have here ready for you. So these are basically the slides that we prepare for weekly lectures. When we take our weekly lectures, we discuss only scenario-based questions because I understand how important it is to get to the bottom of them and go through various resources. So we are back to this particular table. How do dental carious lesions look like? When you have active lesions, they will be white to brown in color. The lesions we saw in Serena, in the patient that we had in our scenario, they were very dark in color, weren't they? So that's our first distinguishing feature. Plaque coverage. You'll see a lot of plaque around active caries. Is that always a necessity? Not always, but most of the times, or majority of the time, you will see that. In arrested caries, you probably will not see plaque around the carious lesions because now the carious lesions have arrested. They've become, dormant. They're not progressing further, and there's no active plaque around them. The active lesions are going to have a matte, frosted, or a rough appearance, whereas the inactive or the arrested lesions will have a glossy or a shiny surface. And the dentine, that when you have a look at these cervical lesions, the active ones will usually be soft. They will not be discolored and they'll be a little bit wet. They will give you that look or appearance, whereas the arrested ones will be extremely hard when you probe them as well, or when you use your spoon excavator, and they will be dry or discolored, heavily discolored. So when you have a clear concept of what my active and inactive lesion looks like, there will be less doubt in your mind. You will be in a less dilemma sort of a position, which is what we avoid at all cost when we are appearing for these exams. So moving on, I hope this slide makes it clear for you to understand why we didn't choose active root caries in our option when we were choosing the particular answer. So coming back to the same question, active root caries, I haven't chosen that as my correct answer because of the way it's discolored and also the way, the kind of appearance it gives me. Although this could be root caries as well, but is it active? Not really. Now, the next question is, like I said, do not think that this is not the same patient that I'm seeing in the first slide. I'm giving you more and more variety of questions, variety of pictures for everyone to, be thorough with these things. What is the white lesion in the cervical lesion on the region of the lower left-hand side molars? So now they've given you these pictures and they want to ask you, what are these white lesions that you see here, probably on these teeth, and also, they're particularly asking about the molars. So is it A, incipient caries, B, enamel hypomineralization, C, food discoloration, or D, arrested caries? If you know the concept, if you have that clarity that we discussed in the previous slide, it should be easy for you to answer this question. A, yes, I am going to keep that answer aside as the correct answer. B, could be possible. I'm not going to deny it completely, but I'll tell you why I'm not choosing that. C, food discoloration. Whenever we see any sort of dietary stains or food discoloration, they will be a bit, different in color. Either they'll be brownish or dark, with a dark hue on the teeth. They will not be as white as you can see in the pictures here. And we know arrested caries does not look anything like this. So I'm going to be choosing between A and B. Why I'm not choosing B is because enamel hypomineralization usually will give you a different kind of appearance as well. If all of you have not gone through what is molar incisor hypomineralization, MIH, what does it look like? I highly recommend going through that. There are various resources. It is present in so many books, Cameron, and your other, literature as well. You can go through some articles from PubMed or ADJ articles. That is what we usually provide as resources to our candidates. But hypomineralization will have a slightest yellowish to brown color. Most important factor is you should have some substantial medical history to back it up. So enamel hypomineralization usually occurs in patients who've got some sort of childhood illness in the past, or if the mothers have taken some strong antibiotics in the last trimester, or if there's been some sort of very long-term illness or any usage of very long-term antibiotics. There could be other reasons. It could be genetic as well. But I'm going to be touching base upon the most common reasons. So these are the kind of things they give you in the scenario, in the history, if they want you to point towards B, or if you have to mark the answer as B. For me, this is a clear-cut case of incipient caries because of the way it looks, right? So the correct answer here is A. But I do recommend, if you're not well versed with MIH and enamel hypoplasia, it is one of the most important topics, not just for the examinations, but for you to make your diagnosis better when it comes to caries. All right. So now we have discussed the diagnostic aspect. What are we looking at? What is the risk assessment? Risk assessment is really important because when you are looking at any case, because here we're talking about caries, you have to do your caries risk assessment. Why does the patient fall in low category or high category of caries? What are the features that I should be looking out for? How many times they're brushing? So if I go back to Serena's case, what will she fall into? Looking at the number of caries she has, looking at her oral hygiene, looking at her work, looking at her social history of smoking 10 cigarettes a day, she is definitely somebody who's in a high category of caries. Right? So this is the risk assessment I'm doing. So similarly, when you have any patient who's got a periodontally compromised dentition, risk assessment is so important because how are you going to otherwise manage the patient, isn't it? So now they want to know from you, the question states, what is your long-term management for the lesion in the molar? And you have various options. You're going to prescribe a fluoride mouthwash once daily for 14 days and review. Are you going to go with option B, where they have diet analysis, oral hygiene instructions, brushing twice with a fluoridated paste, using a mouthwash for 2 weeks and reviewing? Are you going to go ahead with C, which is restoration of the carious lesions with GICs? Well, that does make sense, but I'll tell you how you're supposed to be, finalizing your answer shortly. Are you going to prescribe her a home use of tooth mousse or CPP ACP daily? Or you go ahead with option B, which is plaque control with daily brushing, fluoridated paste using, and application of a fluoride varnish at the dental office every 3 months until she falls into a low risk category. So there you go. They've given you the risk assessment already in the options that she is under a high risk, right? Now, while you're thinking about the answers, let me tell you that when I teach the candidates about how to choose your scenario-based questions correct answer, I always look out for, 1 or 2 options which are very closely related, and I just remove the rest, which don't make any sense at all. And the best method to do that is exclusion. Even if I know that A, B, C, or D, or E is my correct answer, I will always rule out the wrong option first. That's what helps me in reaching my correct answer with much more confidence. When I look at the A option, it says, prescribe a mouthwash for 14 days and review. Mouthwashes are not really recommended for caries control. They can be an adjunct, but they are not the best long-term management available. And if you're not unsure, if you're unsure about these concepts of, fluoride mouthwashes and all that, I do recommend reading TG. Literature on dental caries over there is amazing. You can, give it a read. We do discuss it in detail in our weekly lectures. That's why I'm going to rule out my option A. Option B gives me a little bit more information. It gives me diet analysis. Yes, it's important. I have to know what my patient is eating or drinking. Is she at a risk of further erosion of teeth as well? Is there anything in the diet that can be modified to bring her back to the low risk? Oral hygiene instructions, I agree with fluoridated paste and using a mouthwash. Again, using a mouthwash is not something that I would recommend. I'm happy with diet analysis. I'm happy with oral hygiene instructions, but using a mouthwash again, I might keep this option as my correct, options, but I'll move on now. C says, restoration of the carious lesions with GICs. Will I be treating these lesions with GICs? Absolutely. I will give her a, restoration of any sort because I can't just leave the carious lesion like that. But is that what my long-term management is? So let me draw your attention again to this small little literature that TG has given us, which is the Therapeutic Guidelines, booklet. What does it say when it comes to treating a lesion versus managing a lesion? Okay, so let me just show you this particular slide here. So can you see this, particular line that I have highlighted? It says there is a distinction between management and treatment. Treatment refers to a systematic course of medical or surgical care, whereas management encompasses the overall handling of the patient and their health issues in a sensitive manner. If I have to be restoring the lesion with glass ionomer cements or composites or any other restoration material, I am treating her. I am not managing it. Management involves that I am able to identify the risk factors and I'm able to change or modify them for her, or at least provide the best advice to her so that this doesn't recur. All right. This small sentence holds a lot of importance when you're planning your treatment and when you're managing the patient. So based on that, when we go back to our question, I am not going to be opting for option C. The next is just a home use of tooth mousse. So all of you have to be very well aware of what is, tooth mousse or CPP, ACP, because these are non-fluoride options which we can give to our patients who have incipient caries, where you don't want to do any drilling and, where you don't want to be doing anything invasive. But just home use of tooth mousse is not enough for her. I cannot just, because it's an adjunct again. TG states that it's an adjunct. E option is plaque control with daily brushing with fluoridated paste. So it should be daily twice, of course. And application of fluoride varnish every 3 months at the dental office. That is what I'm looking for. So when I read the second part of my, option E, it kind of reinforces or strengthens the fact that I am doing something, or I'm managing the patient and I'm calling her until she falls into a low risk category. So all of the candidates who have enrolled with me and have been taught by me, they know that I love the term wholesome. When you have an option which is wholesome in front of you, which gives you an entire description, you immediately fall in love with that option. You will not beat around the bush and try to find the keywords. You will know that, okay, this makes sense, and I'm going to mark this as my answer. So for me, the correct answer to this particular question is going to be E. Remember, we had kept option B in the sideline as well. Maybe that could be correct. But when I have to choose between fluoridated mouthwash and fluoride varnish at the dental office, that's where I'm going to go ahead with me. I'll place my bets on option E. So I hope these small little tips and strategies help you out. But let me tell you, if there is insufficient knowledge or information or concept clarity, nothing's going to help, right? So please keep studying and strengthening your concepts. We've got one more question, and this is just, again, let's not think that we are talking about the same picture that we saw, but she's the same patient. You've spotted caries on 1-3 and it looks like this. And the question states that it's broken down, there's caries, and it's extending 1 millimeter subgingivally. What is the most appropriate treatment for her caries on 1-3? Now they're asking you for the treatment. They're not asking you for the management because you've already dealt with that. So what are you going to do? Remember your keywords. She's working at a farm. She has financial constraints. She probably cannot come back and forth. And she's not concerned about her aesthetics. I know I've given you a lot of hints, but that's exactly how you should be thinking in the exam as well. Option A is laser treatment for exposure of the gums or the gingiva and filling with a composite resin. Option B is placing a compomer restoration. C is extruding the tooth and replacing the tooth with replacing this with a porcelain fused to metal crown. And D option is removing the caries and placing a resin modified glass ionomer. So you remember in the last slide when I was discussing this, I said there are going to be a few options which are just not going to make sense. And when I look at these options, option C is just absolutely, as I say, irrelevant. I'm going to just throw it out of the window right away. Because why would I be doing anything as invasive as a PFM to replace this amount of caries? Option A is my next on the radar for exclusion. Why? Because she's not concerned about aesthetics. She's not concerned about, how good the teeth look. And financial constraints is what my barrier is here. Laser treatment, composites, everything will cost her more money, right? That's why A and C go out of the window. B and D remain. Between compomer restoration and resin modified GIC, I'm going to go with something which is more tolerant when I'm placing the material subgingivally. You've got to remember that a composite or any resin, material which I place under the gums may not be as successful as it would be in an absolutely isolated environment, right? So unless I'm doing something to the gums here, removing the gums, I don't think I should be choosing anything with a resin component. Why do I go with D as the answer here, which is my correct answer? Because resin modified GIC, even though it has a small amount of resin component, it is going to give her some amount of fluoride release. All right. And it's going to give me good, at least decent aesthetics. I will not say the best when you compare it to others, but fluoride release and GIC being the, moisture tolerant material that we have, it is a better option than choosing compomers. I haven't really seen a lot of indications for compomers or using compomers, in the daily life dentistry as well. So this patient has been now treated with GICs, which even though she's working in a farm, she may be living, far away from the city, but we know that the lesion is covered. Okay. And we are not breaking that financial constraints that she has. And we are not even giving her unrealistic treatment options like lasers and everything. So this is what, essentially our discussions are like. When we are discussing all these questions in the weekly lectures, which we have every Tuesday, we pick up one scenario, but we don't just talk about the scenario-based questions. We talk about the patient as a whole, because you're going to be dealing with the patient when they come to your clinic. And that's what these examinations demand. If you want more such tips and tricks and, more such information, keep following the channel, of course. But our coaching is wholesome, as I would like to say, because we will give you that, that pattern, that organized structure that you need and which you can follow, even if you're somebody who's working 9 to 5, you will have at least a syllabus to follow and a checklist to, mark as in when you complete these important topics. Thank you so much for watching, and we'll come up with some new topic really soon.